Dizziness can be a sign of something more serious, particularly if it's coming from different parts of the brain. The key symptoms that drive someone to see us is when dizziness has had a great impact on their life, whether it's contributed to falls or an instability where they feel like they're going to fall, a difficulty in performing a sport, difficulty walking up or down stairs. And when it's impacted their life like that, when it's impacted their work, when they're having difficulty looking at different screens and they're getting dizziness and visually induced aspects, that's another reason why someone would consult us. Constant dizziness is actually having an impact on their lifestyle, on their anxiety levels. It can contribute to depression. So if you find that dizziness is having a great impact on their life, be sure to visit us and we'll be able to help you. To diagnose dizziness and vertigo, the skill of the examiner and the practitioner really relies on a number of things. It relies a very accurate history, a physical assessment, and ideally the use of diagnostic equipment. And I'll show you some examples here. We've got what we call a V&G, or video nystagmography. Basically, it's where we have infrared cameras that are built inside a goggle, and we have patients looking at a screen and they're following certain objects on the screen. And we can accurately, to degrees of movement, measure how their eyes are tracking. So we use eye movement as a great way to assess someone's dizziness. We look at balance, we look at mobility tests, amongst other tests, to be able to determine and evaluate dizziness. Dizziness can be a sign of something more serious, particularly if it's coming from different parts of the brain. We know that there are certain conditions, some neurological conditions, that have dizziness and vertigo as a symptom. So having an examiner look at the various components of brain function can certainly help identify those likely causes of more serious cases. Also, medication, and whether it be properly prescribed or improperly prescribed, can be a cause of it as well. So you should be working with an allied professional with training in vestibular therapy, or consult your medical practitioner to be able to confirm whether there is a more serious cause to your dizziness.